Hello and welcome to Medical Dialogues. I'm Anchika Mishra. Let's look at today's top medical news. Reducing processed meat intake linked to health benefits according to a study. Reducing consumption of processed meat by around one-third could prevent more than 350,000 cases of diabetes in over 10 years, a study published in the journal The Lancet Planetary Health suggested. Processed meat, which often contains high level of salt, fat and preservatives, have been linked to an increased risk of various health issues, including heart disease, type 2 diabetes and certain cancers, particularly colorectal cancer. By cutting down on processed meats, individuals can lower their intake of harmful substances, leading to improved cardiovascular health, better blood sugar control, and reduced risk of cancer. A team from the University of Edinburgh and the University of North Carolina developed a simulation tool to estimate the health impacts of reducing processed and unprocessed red meat consumption. While many studies link high processed meat consumption with chronic diseases, fewer examine multiple health outcomes, and evidence based on unprocessed red meat remains limited. Using the Center for Disease Control and Prevention health survey data, researchers created a representative micro-simulation of the adult population.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
Study finds link between semaglutide and a rare blinding condition. A new study led by investigators from Mass Eye and Ear has discovered that patients prescribed semaglutide for diabetes or weight loss had a higher risk of developing a potentially blinding eye condition called the non-arthritic anterior ischemic optic neuropathy (NAION) compared to similar patients who had not been prescribed these drugs. The findings were published in the journal JAMA Ophthalmology. Non-arthritic anterior ischemic optic neuropathy is a relatively rare condition affecting up to 10 out of every 100,000 people. It is the second leading cause of optic nerve blindness following glaucoma and the most common cause of sudden optic nerve blindness. NAION occurs due to reduced blood flow to the optic nerve head, resulting in permanent vision loss in one eye. This condition causes painless visual loss which may progress over several days before stabilizing. There are currently no effective treatment for this disease. For the study, researchers examined the records of over 17,000 patients treated at Mass Eye and Ear over 6 years since the release of Ozempic. New findings on cellular mechanism for brain energy may improve late-life brain health. A key mechanism which detects when the brain needs an additional energy boost to support its activity has been identified in a study in mice and cells led by UCL scientists. These findings, published in the journal Nature, could discover new therapies to maintain brain health and longevity, as other studies have found that brain energy metabolism can become impaired late in life and contribute to cognitive decline and the development of neurodegenerative diseases. Previous research has shown that astrocytes, a type of star-shaped brain cell, help supply energy to brain neurons. Astrocytes are glial cells, which are non-neuronal cells found in central nervous system. When nearby neurons need more energy, astrocytes quickly activate their own glucose stores and metabolism. This process increases the production and release of lactate, which supplements the energy available for neurons in the brain. In a series of experiments with mice and cell samples, researchers discovered specific receptors in astrocytes that detect and monitor neuronal activity. These receptors trigger a signaling pathway involving adenosine, a key molecule. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.